Hi, this is Paige Pradko. Welcome to Therapy for a Better Life. Today's topic is anxiety disorders. You're going to be learning a lot in this video series about anxiety and what are some of the best treatment methods and best techniques for reducing your anxiety. I've been treating clients with anxiety disorders and panic disorder for almost 20 years. I've learned what works best. I've even developed my own method called the C.A.L.M method. And it's an acronym, and you'll learn more about that in this series. But what is anxiety anyway? Anxiety is just our own mind-body response to stress, or maybe even just a worrisome thought or an event coming up. It's like our own little body's alarm system that says, hey, something's going on, you might need to do something here. And we, should pay attention to it when that alarm goes off. But when does it become actually an anxiety disorder? Anxiety becomes an anxiety disorder when it becomes very excessive, when it starts to impact our ability to function normally in our everyday life. Clients, that I see for anxiety, they kind of have this overestimation of danger and this underestimation in their own ability to cope with their anxiety. And so what I do in therapy is I am working really to reduce that sense of danger in their body and their mind and to increase their ability to cope. Part of that ability to cope is learning what to do when. So we're gonna talk about that. But there are different types of anxiety. There's generalized anxiety, panic disorder, social anxiety, phobias, agoraphobia, separation anxiety, OCD and related disorders and PTSD. They're similar. They're in a little bit separate category, but sometimes they have the same symptoms. And people can have more than one anxiety disorder at a time. Also, when you work on one type of anxiety, it actually, all of your anxiety symptoms tend to improve, even in related anxiety disorders. For example, I have had a client who had an extreme phobia of snakes. And this particular client, she couldn't get out of her car or open cupboards because of this extreme fear. Most people can live with the fear of snakes and not have to do anything about it, but hers was severe. So we started very intensely working on her phobia, but she found all of her other symptoms of anxiety, like generalized anxiety, social anxiety, all those other anxieties started to die down as well as we were working. So this is wonderful, because even though in this series where I really do concentrate on generalized anxiety disorder, those of you with panic disorder, social anxiety disorder, other anxieties, you will find that working on these techniques, they cross over. You will find your anxiety disorder symptoms also reducing. So generalized anxiety disorder, just to be clear, is you will see this person with a lot of tension. Maybe you have a generalized anxiety disorder. It's been going on for more than 6 months, maybe your whole life. But you have a lot of worries, a lot of ruminating thoughts, some muscle tension. When your stress is really up, you'll have difficulty sleeping, and sometimes can even, be irritable. These techniques are going to be very, very helpful for you. So what exactly is my method, the C.A.L.M method? It's an acronym. And C stands for calming the body. And in the next video series, I'm going to begin the techniques on calming the body. So everything under calming the body, there are a lot of somatic techniques, relaxation techniques. You're going to be really working on relaxing the body. The next letter A is for acceptance, accepting anxiety. And in this video series, you will learn about mindfulness and acceptance and commitment therapy, ACT techniques. I'm just going to share the best of the best with you. And you will gain a lot from this, this particular video on reducing your anxiety through acceptance. The next letter is L, and that's logic. And under the logic section, I teach the best CBT and also some DBT techniques. CBT stands for cognitive behavior therapy, and DBT is dialectical behavior therapy. So again, I picked kind of the best of the best for that section. And the last letter in CALM is M, and M stands for moving on. In this video on moving on, we'll be training your brain to focus on some other areas other than anxiety. And it's very helpful for some distraction methods and just kind of getting yourself out of your mind and connecting to other things that you can do to reduce your anxiety. So I hope that this was an informative video for you, and I hope you're excited about getting started and learning how to calm your body. And to get right to that next video, beginning my CALM method and calming your body, just click here. And to subscribe to my channel and learn more about mental health techniques and mental health topics, hit subscribe here. Thank you, and I look forward to seeing you next time. Bye-bye.